questions that you will have to answer. You will have for each question between 10 seconds and 20 seconds, depending on the question. So good luck to all of you, and I hope that you give your best. Of course, to participate in this, you can go to menti.com and then enter the code, or just scan it here so you can participate and vote with your friends. As soon as you enter, you'll have to enter your name or your. It doesn't have to be your name. You can just enter whatever name you're comfortable with, so it's anonymous. And good luck. Let's begin. So just an introduction about me so you can know about the person presenting this today. So I'm a 7th year medical student, and I'm deeply passionate about medicine and dedicated to helping others. I have some certificates and accomplishments. Of course, you can ask me about it in private or here. So I've done some certificates online, and some of them I've done it in conferences or by doing the work, like being a former president of the Office of Sports and Arts at my university. So I hope that each one of you take the chance and the opportunity to participate in something in your university or outside of it, so you can have a life full of experiences. So are you ready to dive into today's case? You can answer in menti.com. Yeah, that's cool. Okay. So you can type whatever you want, like nobody will see who is typing this. Okay, absolutely. Well, I like this. I like this energy. So let's go into the case. So this is our case. It's a 25-year-old patient who palpates a nodule in the right breast. So on clinical examination, the nodule is in the upper outer quadrant of the right breast. It is well delimited, mobile, relative to both planes. So I'll let you read this too for 5 seconds, and then we'll go to the questions. Okay, now let's go to the question. For those who want to join, they can just enter menti.com and enter the code here so that they can join. Okay, now we have 6 players and it's so good. Okay, we'll wait just another minute and then we'll go into the question. Okay, I see the people who are doing the thumb up. Thank you. Okay, just another minute. Okay, let's go into the question. This is your first question. So answer fast to get more points. So what to do next after seeing this palpable mass? Will you do a clinical monitoring in 3 months, a mammography plus breast ultrasound, breast MRI, breast CT? What will you advise your patient to do? Okay, so everyone is voted. Okay, that was fast. But the right answer was breast ultrasound. So let's see the leaderboard. Okay, so Wiam was the only one who answered right. That's good. She was fastest. Okay, now let's go to the next one. You still have other chances to answer right. So yeah, it is the breast ultrasound. Why? Because this patient is a young patient. I'll not tell other details because you will be having other questions related to this. So what you have to keep in mind is that this is a young patient. She is just 25 years old, so we will just do a breast ultrasound. Now the second question. Okay, so now we have 7 players. You all have the same chances to win. So, okay. Answer fast to get more points and right, of course. From what age can one request a diagnostic mammogram in the presence of a clinical warning sign? Is it 20 years, 30 years old, 40 years old, or 50 years old? From what age you can advise your patient to do a mammogram? Okay. Okay. Yeah, it's 30 years old. Yeah, our patient, we said that our patient was young. She was 25 years old. So that's why we advised her to do just ultrasound, no mammogram for patients under 30 years old. So now let's see the leaderboard. Okay, now it's Zlatan. Okay. So this is just a recap from the presentation that we did last week. So we defined the difference between the diagnostic mammography and screening mammography. So a diagnostic mammography is requested in the presence of a clinical sign, but screening mammography is requested without a clinical sign, starting at age 45 or 50 if no personal or family history of breast cancer, and it's done every 2 years. So in this one, we are talking about diagnostic mammography. So in this patient, we have a clinical sign and she is 25 years old. So we're talking about whether we should do a diagnostic mammography or not. So now, should we do a diagnostic mammogram or breast ultrasound? Starting from 30 years old, a diagnostic mammogram can be requested. And before 30 years old, a breast ultrasound is requested because the dense breast tissue in this age group can make mammograms less informative, and the breasts are more sensitive to irradiation at a young age. So in the other presentation, we've said that the mammogram doesn't have a lot of radiation compared to CT. So now we're talking about not doing it to young patients. So yeah, we shouldn't risk, even if it's small radiation, we shouldn't give our patient radiation if we will not be having results from it, good results. So if we have a young patient under 30 years old, we should just do a breast ultrasound. If she is above 30 years old, then do a diagnostic mammogram. So you can, because it can add other informations for you, of course. So this is the question. This is not a question that you will be noted at. So are you familiar with the BioRed system used in breast imaging? This is just to know if you're familiar with, so we can explain it a little bit more. Okay. So happy that there's a lot of you that knows about it. And for the others that doesn't know, we will dive into the details so that you can know just as the other ones know. So BIRATS is the breast imaging reporting and data system. It is a risk assessment and quality assurance tool developed by American College of Radiology that provides a widely accepted lexicon and reporting schema for imaging of the breast. It applies to mammography, ultrasound, and MRI. So to summarize, you can classify the things that you find in the while doing a breast imaging by the BIRATS. It's like a language between doctors so that they can know if it is benign or malignant. So here is it. So the breast imaging studies are assigned one of 7 assessment categories. We have BIRATS 0. It means that it's incomplete and that it needs additional imaging evaluation. There is also BIRATS 1. It means that it's negative, so symmetrical and no masses, architectural distortion or suspicious calcifications. So BIRATS 1, it's the normal one. There is BIRATS 2, which means that we found something, but it's benign, so 0% probability of malignancy. And there is BIRATS 3, so it means that it's probably benign, so it's inferior 2% probability of malignancy, and we request that the patient have follow up, so that short interval follow up, of course. There's also BIRATS 4, so here it's suspicious for malignancy because there is between 2 and 95% probability of malignancy. And here there is BIRATS 4A, 4B, and 4C. For 4A, it's low suspicious for malignancy. 4B, it's moderate suspicious for malignancy. And 4C, it's high suspicious for malignancy. So in this case, biopsy should be considered. There's also BIRATS 5. It's highly suggestive of malignancy. So in this case, appropriate action should be taken. And there's BIRATS 6. So this means that is known biopsy proven malignancy. It means that the patient has done the biopsy and it's proven that it's malignant. So in this, you can screenshot this page because you will need it after this in other questions if you want, or just remember what each one of it mean so that you can answer right. We'll be having 2 questions about this. So now we will go into the next one. Yes, here we are talking about our patient in this case. So it was a 25 years old patient. You've requested that we do a breast ultrasound. So here is the breast ultrasound that you've requested. And it is classified ACR 3 or BIRATS 3, as you can see here. Here are more details. So in this breast ultrasound, there is a mass at the upper outer quadrant of the right breast, oval and shape, a major axis parallel to the skin, regular contours, hypoechoic, enhancing echoes posteriorly, and there's 19 millimeter classified ACR 3 or BIRATS 3. Now here's the question. So it's BIRATS 3. BIRATS 3. Remember what you should do if your patient have BIRATS 3. Answer fast. Get more points. What do you propose? Do nothing, a mammogram, a control ultrasound in 4 to 6 months, a control ultrasound in 1 year, an echo-guided microbiopsy. Okay. Yeah, so it's okay for the ones who didn't get it. We are learning here, so you're learning and you're here, of course. So it's so good. Okay, so the right one was a control ultrasound in 4 to 6 months because it's Bayard 3 or ACR 3. So it's probably benign, but there we need a short interval follow up, as we've said. Okay. That was good. So most of you answered the right. Okay. Okay, so now you've requested that we do a follow up. So this is the follow up that the patient did. So this is a 6 month ultrasound control. And as you can see here, it increased in size to 22 millimeter. So in the previous one, we've seen that it was 19 millimeter, but now it is 22. And it is reclassified as Biarritz 4A or ACR 4A. So insist on this one. And yeah, there's a detail that we will add to this one that can happen to anyone. So her doctor decided to request an MRI for further evaluation. And the patients, of course, agreed and the MRI was performed. Okay, now we have 8 players. That's good. More competition. Answer fast to get more points. Do you agree with the decision to proceed with an MRI? Yes or no? Okay, let's see. Yeah, no. That is right. It's no. An MRI shouldn't be done in this case. Okay. Okay, here's the next question. What do you propose? Okay, we've said that an MRI shouldn't be done. So what should you do in this case? Do nothing, a mammogram, a follow-up ultrasound, a breast MRI, an echo-guided microbiopsy. Yes. Okay, that's okay. For the person who answered the mammogram, it's okay. We're learning here, so we're happy that you're here and voting with the other ones. Yes, it's an echo-guided microbiopsy. Yeah, that was right because as we've said, it is Bired 4, so it is suspicious, so we should do a microbiopsy. Okay, let's see who's the first one now. Okay, so Clostridium answered right. Also, Yasin. Okay, so it's always changing. There is always a hope for each one of you to win. Okay, this is the next one. What do you propose? Do nothing, a follow up ultrasound in 4 to 6 months, a mammogram, a follow up breast MRI, surgical excision. Oops. Okay, so this patient has done what you said. She has done the microbiopsy, and after the microbiopsy, they found fibroadenoma. So she should be doing a follow-up ultrasound in 4 to 6 months. That's okay. So yeah, she did an echo-guided microbiopsy. They found a fibroadenoma, and then she needed to do a follow-up ultrasound in 4 to 6 months. Let's see, didn't change. So yeah. Okay, just to remember who was the winner. So, given the increase in size, it was decided to excise the noodle with an extemporaneous examination. Yeah. And the post-operative, they found that the patient had a grade 1 phyllodes tumor with atypical ductal hyperplasia at an excision margin. So for the lesion at risk, it is indication for annual surveillance. So the patient should do annual surveillance. This is our take-home message for today. So in the presence of a clinical sign, for the patient above 30 years old, a diagnostic mammography is requested. For the patient under 30 years old, a breast ultrasound is requested, just a breast ultrasound, no mammography. And of course, screening mammography starting at 45 or 50 years old. It is performed every 2 years, as we've said in the previous presentation. So just keep this in mind. For the BI-RADS classification, it's so important because it's just give us an idea of if it is benign or malignant or what, and it's just direct us to what we should do next or what we should advise the patient to do. So it's so important. And of course, a follow-up after echo-guided biopsy if the lesion is benign, it's so important. So even if the patient after doing the biopsy finds something that is benign, she should do a follow-up. She shouldn't just be relaxed and do nothing. So a follow-up is always needed. And yeah, that was it. So as we conclude, I want to extend my heartfelt gratitude to two remarkable mentors who have greatly enriched this presentation with their wisdom and expertise, as I always consult them in this. So Dr. Nadia Sqali and Dr. Asma. Thanks to both. And of course, I have a form, so you can just give me your feedback and I will try to make better presentations for all of you according to your feedback. And it really makes a huge difference to hear back from all of you. And remember, the journey of medicine is challenging, but it's a path that leads to incredible moments where you have the power to touch lives, change futures, and heal not just bodies, but hearts and souls. So keep pushing forward, because we need each one of you. And thank you for your attention. You've all been fantastic.